Hello and welcome to Fiberman. I come across this article about fibromyalgia, but phase 3 data for fibromyalgia digital therapy. That sounds a bit strange to me, so I thought, hang on, I'll have a little read and see what it's about. And it's interesting. Whether there's anything that really is that interesting, well, it's yet to be seen. Now, it says here, the data from the phase 3 study showed the efficacy of Swing's smartphone-based behavioural therapy stanza in improving fibromyalgia symptoms. Now, don't get me wrong, I love technology, but it does worry me that we are too dependent on technology. In the sense that when something goes wrong, it affects everything. We're just seeing this today, actually, with this company called CloudStrike, whose update has literally wiped out loads of Windows-based machines and systems and airports and banks and God knows what else. But anyway, it's caused a huge amount of problems. Now, they say improving fibromyalgia symptoms. How are you going to do that with a smartphone app? So Swing Therapeutics have published positive results from the phase 3 trial of its digital therapeutic stanza for the treatment of fibromyalgia symptoms. The randomised active phase 3 Prosper FM study evaluated the effects of 12-week self-guided smartphone delivered digital therapeutic on fibromyalgia management. And the results from the trial were published in the Lancet, which is like a medical journal. Now, fibromyalgia is a chronic disorder. Yes, tell me about it. I have fibromyalgia, and it's horrible. And it causes pain and tenderness. Yes, I get a lot of tenderness in my head. I get a lot of pain in my left arm, across my ribs, sometimes in the back, sometimes in my legs. Yeah, it's not great. Also accompanied by fatigue. Yes, I get very tired, hence I'm sitting in this hammock at the moment. Feel that I'm going to have a bit of a snooze because I'm shattered. Sleep problems, apnea and what have you. Memory, yes, I get brain fog as well. Forget things. And mood issues, yeah, I'm up and down. I am up and down. One moment I'm kind of like all chirpy and cheerful, my usual sort of self, and next minute I get like a rush of anxiety. And I'm not such a nice person to be around when I'm like that. It's not great. And the disorder has a global prevalence of 2 to 4%. That's a lot. Stanza is self-guided acceptance and commitment therapy, a type of cognitive behavioural therapy, a CBT. Now, the device received a de novo authorization for treating fibromyalgia symptoms by the US Food and Drug Administration in May last year, 2023. And phase 3 trial enrolled 275 patients with fibromyalgia aged 22 to 75 years of age at 12 weeks. Now, 71% of the participants in the stanza treatment arm reported an improvement in well-being measured using patient global impression of change compared to 22% of the active control group. So it's an app that helps you manage. That's what I make of it at the moment. That helps you manage your fibromyalgia symptoms. It's not really a treatment, is it? It's just it's therapy, in that it's a way for us to control, or like medication, or sort of stuff, I suppose. The stand also exhibited statistically greater improvement compared to the control of fibromyalgia-related symptoms, function and impact, as well as pain intensity, pain interference and fatigue and sleep disturbance, and depression. And I do suffer with depression. No device-related safety events were reported. The fibromyalgia options are typically limited to a handful of pharmacological interventions that have limited efficacy and that can come with difficult to manage side effects, said Mike Rosenbluth, CEO of Swing. Now, this publication validates stands as a guideline-directed non-drug approach to fibromyalgia, and many patients previously couldn't access it due to the few available trained clinicians, geographic limitations, and cost. Well, now, obviously, if it's going to be widespread, if it becomes recognised as a recognised treatment, well, the cost is going to come down and it's going to become more available. It's bound to. There's been an increase in the number of new digital therapeutics for a variety of conditions, and the US digital therapeutics is projected to grow at a compound annual rate of 25% in 2022 to 2030. However, reimbursement of these therapies is expected to be slow and adopted at these therapies as per the global data report. In other words, you've got to pay. Oh. So, I hope it's light enough. That's just... Anyway, in June 2023, the UK's National Institute of Health and Care Excellence, NICE, NICE, approved the 9 new digital therapies for patients with mental health illnesses to be used in the country's National Health Service, and the recommendation includes 6 therapies for anxiety disorders and 3 for depression. That is quite hopeful, and knock me down with a feather. Yeah, it makes me wonder though, where are we heading? If we get treatment, get therapy through our app. If it works, all our doctors and nurses are made redundant, wouldn't they? It makes you wonder, doesn't it? Where we're heading with all this. Is it positive? Well, yes. If people are benefiting from it, most definitely. Am I a bit sceptical? Yes, I am. I think when you put the treatment in the hands, of the individual, sometimes it's that individual doesn't have the energy to actually see it through. Especially with fibromyalgia, because in the day we're knackered half the time. And remembering stuff is a problem. Actually remembering to do stuff. Oh damn, I need to do my app. That sort of thing. It could be problematic. That's what I think anyway. What do you reckon? Do you think it's a good idea? Yeah? I'll leave it in the comments down below. Toodaloo.